Testosterone is a hormone synthesized primarily in men's testes from the substrates cholesterol and acetate. It plays an important role in reproductive organs and physical characteristics of adult males. It affects muscle development and strength. Testosterone also has stimulatory effects in erythropoiesis by increasing erythropoietin. Serum testosterone levels naturally decline after the age 30 and continues to decline about 1% throughout his life. Men with lower than normal testosterone levels have testosterone deficiency or hypogonadism, which prevalence varies from 9% among 50 years to 49% among 80 years and older. Testosterone deficiency has been reported to be associated with erectile dysfunction, depression, decreased cognitive ability, lethargy, osteoporosis, and loss of muscle mass and strength. Serum testosterone levels are inversely associated with major causes of mortality, such as cardiovascular disease. Testosterone replacement therapy, or TRT, is currently prescribed for older men with hypogonadism due to its health benefits that increase health span in men. Established benefits of TRT include increased muscle mass and strength, decreased fat mass, increased bone mineral density, and improved sexual function. Men with no symptoms of hypogonadism are not advised to undergo this therapy. According to studies, TRT may increase risks in the development of polycythemia, decrease in HDL, breast tenderness and enlargement, prostate enlargement, increases in serum PSA, and prostate-related events. We would like to hear about your own experience with this topic. Leave a comment. If you have any friends who may find this information helpful or interesting, you can use the share button and share this video with them on Facebook, Twitter, WhatsApp, or any other social media. Lastly, remember that it is important to talk to your doctor or other professional before beginning any sort of supplementation or treatment. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.